And Dr. Neeraj is talking about Universal Integrated Electronic Eyedrop Sleeve, a novel compliance monitoring system for glaucoma patients. Dr. Neeraj.
Thank you. I was the first speaker in the last AIOS also. So this is,
Lucky for you.
yeah. Just pause one
You get a
second.
purple cap for if it's a hat trick.
Can we, yeah. So good morning. I'm going to talk on Universal Smart Integrated Bluetooth. Yeah. So can we have the video? It's a video presentation, which is a Bluetooth eye drop for glaucoma patients and other specialties. Can we start the video and the timer? Video, please. With the
All
volume.
know that glaucoma is the second most common cause of blindness worldwide. Topical medications are gold standard for treatment of glaucoma. Literature suggests that up to 50% of patients are non-compliant in glaucoma medication. This further leads to progression of the disease. Smart Bluetooth enabled devices have taken over the world, and it is when we had a research question to incorporate Bluetooth technology into eye care. Thus, we innovated the world's first smart Bluetooth-enabled eye drop sleeve, which is a novel innovation combining eye drops and the Bluetooth mobile technology. Components of auto drops include a battery pack, a USB-C port charging device, a microprocessor unit, a motion sensor, and a sleeve with a squeeze sensor. Overall, the device looks like this when combined. Any eye drop of patient's choice can be clipped onto the eye drop sleeve. The USB-C port is used to charge the Bluetooth sleeve. It has a battery life of 20 days when charged for 3 hours. This further comes with a drop guider to make sure that the eye drop actually falls into the patient's eye. The beauty of this device is that as soon as you tilt the sleeve and squeeze the sleeve, and as soon as a drop is instilled, the mobile application that it is connected to via Bluetooth will document the exact time and the number of drops instilled. This is an application with an alarm-based system which does not go off unless and until you actually manually switch off the alarm. Once the alarm is turned off, the patient then takes the entire setup and actually makes sure to put the drop guider on the eye drop sleeve. The drop is then instilled by the patient in his eye. As soon as the drop is instilled in his eye, there is a record that is saved on the mobile application with the number of drops, time, and the date of installation of the eye drop. The mobile application has a very simple user interface with the name of the drop, the time, the date, and number of times that has to be put in the patient's eye. Not only this, but you can actually select different ringtones for different sleeves or eye drops to be instilled. On the other hand, every time the patient is instilling the eye drop, an automatic CSV file is created in Excel format that can be seen by the surgeon on any visit. This will be emailed to the surgeon timely to make sure that he comes to know about the compliance of the patient.
We're also very happy to get a funding from His Highness, and now we are coming up with a marketed product which will come in the month of September. Thank you. This is how the final product is now going to look like. So I have the 3D printed prototype over here, which is a fully functional prototype. His Highness has now tied up with us, given us a funding. They've come up with a final product, which they will be selling along with their glaucoma eye drops free of cost. So one sleeve in a pack, which will be given to every patient who buys the glaucoma eye drop first time. And that sleeve can be used for multiple drops. So no cost for the patient. That's the MOU signed with His Highness.
Yeah, but then you should ensure it goes to other companies too, no? You need a
So-
larger footprint.
So at present, because they have given us a funding,
Yeah.
I can also tell the amount. It is a funding of 10 lakh rupees. We have got it from them and we have already started work, like you saw the final product. Further, there is also a clause which mentions that we can also give it out to other companies also, of course, with the help of His Highness Ophthalmics.
Very nice. Very nice.
Not only glaucoma, but even other diseases like dry eye, cataract. You know,
Yeah.
it can be used for.
Wastage of drops will be
Yes, so
prevented.
you come to know how many drops, exact number of drops, exact time, if the patient has missed the drops. Everything is, there are two interfaces. One goes to the surgeon via email, a CSV file. So every time you squeeze the drop, the mobile application has two phases. One is the patient interface and one is the doctor interface. Patient relative can see at night if the relative of the patient is coming home and saying my mother has not put the drop. So he can see, and the surgeon automatically gets an email every time the patient has put the drop. Obviously, surgeon doesn't have time to see all the drops, but he can come to know how much is the compliance.
Compliance. Very
Further, we'll also integrate percentage. So we'll give a pie chart where the surgeon can see.
The backend is what, progressive web application, or is it written, coded in a
I-
lower language?
No, so it is a proper UI based application which is being again made by a IIM and a IIT based person who stays in Hong Kong. So he is IIM plus IIT and he is working on it. We have hired him and he's the one making a proper application, which is going to be one application for the patient and the doctor both. But unfortunately, what we have also done is that because no surgeon would want to download an application, we've also added a email. So
Yeah, so that was the catch, you know.
yes.
I
You don't
think,
want anything
I
installed
think
on
we
your
should
system,
go on
so
to our
yeah.
next speaker.